Buddy, my name is Chuck Schofield. I'm Executive Vice President of Share Our Strength. I work on our No Kid Hungry campaign with our program team, and I want to welcome you all to today's edition of the Conversations on Food Justice series. Thank you so much for being here with us today for this timely conversation. I want to begin by thanking my colleagues at Share Our Strength, especially Elliot Gaskins and Julie McNulty, who designed and put together this series. Elliot has actually moved on to a new role as Chief Development Officer at the Barbara Bush Foundation for Family Literacy. And I just wanted to acknowledge his leadership and role in this series. We're going to miss him, but we're very grateful for his work both here and there. I also want to thank our partners at Food and Society at the Aspen Institute, especially Corby Kummer and Mary Castillo. Thank you both so much for your tremendous partnership and ongoing support. All right, so let's get to the conversation. We've got a lot to cover and an amazing panel. We obviously have historic elections ahead of us and a panel of experts today who are going to discuss how elections shape our food systems. Today's conversation will be moderated by my colleague, Jason Gromley, who is Share Our Strength's Senior Director of Advocacy and Government Relations, where he utilizes his deep knowledge of government relations, health policy, and movement building to develop and advance public policies to end hunger and poverty. Prior to joining us, Jason was on the leadership team of the Root Cause Coalition. So I'm going to hand it over to Jason in a second, but I encourage you all you can list your questions in the chat or make comments that we'll be tracking as well. And I'll hand it now to you, Jason. Thanks so much.
Thanks, Chuck. And thank you to everyone who's taken the time out of your day to join us for this very important and, as Chuck said, timely conversation. As Chuck mentioned, my name is Jason Gromley, and I'm the Senior Director of Advocacy and Government Relations at Share Our Strength. And I'm very excited to be joined today by a panel of experts who collectively have decades of experience in research, in government, and public policy change. So first, I'm happy to welcome Stacy Dean, the Carbonell Family Executive Director at George Washington University Global Food Institute, Indi Dutta-Gupta, Roosevelt Fellow at the Georgetown University McCourt School of Public Policy, Angela Rashidi, Senior Fellow at the American Enterprise Institute, Tariq Sheriff, Business Development and Strategy Manager for the Government of the District of Columbia, and last but certainly not least, Elaine Waxman, Senior Fellow at the Urban Institute. So big thanks to all of you for joining us today. And we're just going to jump right in because we got a lot of ground to cover today. So to get us started, I want to ask each of you to share what's top of mind for you as you consider the state of the world, the upcoming election, and everything that's going to come after that. What are you thinking about when it comes to food systems and food security? So why don't we stick to that same order and start with Stacy? Why don't you get us started?
Well, thanks, Jason, so much for having me, and it's great to see everybody here today. You know, I think we face great challenges with respect to food security and food systems at home and globally. There are just far too many individuals and families who are food insecure. That's true here and certainly true globally, where that challenge extends into severe hunger and malnutrition. There are too many struggling against nutrition insecurity, where the foods they're eating are contributing to poor health. And we've got a food system that's contributing about 30% of carbon emissions come out of the agriculture and food system. So that's just three challenges to name a few, and there's certainly more I know others I'll talk about. But I also see great positive momentum in tackling these issues. This forum today is a great example. We're identifying the issues, we're talking about them, and we're forging a path forward. And we've had a couple of years coming out of the pandemic of really seeing what works. And I think what I want to hope to see is continued momentum, sort of as a society and a community, in working to take on these issues.
Great, thanks, Stacy. Indi?
Thanks, Jason. Let me just add a couple of items to Stacy's great list. When I think about food justice issues with regard to the upcoming election in particular, I think a lot also about immigration and agricultural labor, as well as climate change, and also the role of trade, international trade. which is obviously playing a central role in the campaign. So with regard to immigration and agricultural labor, we obviously could see changes in our immigration policy, both as it affects immigrants who are already here and the potential new entrants who have helped boost the U.S. economy and population growth overall in recent years. So that's something I'm paying certainly a lot of attention to. And then climate change, and especially as it relates to extreme weather, but also even just the gradual shifts that are happening can certainly affect our food insecurity and even nutritional security situations. And of course, we're seeing very different views on what, if anything, to do about addressing climate change right now. And then finally, I'll just touch a little on international trade, which can also interact with the other two issues. But right now, a sizable share of our food in some way or another comes from abroad. And in particular, if we worry about things like the cost of food at home, there's a real risk of tariffs or other changes, not just in the short run, and even after companies sort of adjust and adapt over time, sort of limiting potentially the availability of food options as well as affecting the prices.
Great, thank you. And that's a great prelude to a lot of the conversations we're going to have today. So I appreciate that. Angela, how about you? What's top of mind for you?
Sure. Well, first, just thanks for having me. It's great to be here with everybody. In terms of top of mind, I guess for me, it's really health and nutrition. I think we as a country are facing some very challenging times in terms of the health of our population, and specifically to food systems and food security. Nutrition is top of mind and how that relates to health. And then my work, I focus on safety net programs and how effective they are in addressing poverty and upward mobility. So really top of mind for me is how our safety net programs are addressing the problems that we're facing as a country in terms of health. And certainly, diet-related disease and health issues are not specific to low-income populations, but they do suffer disproportionately from some very concerning health trends, and it affects various aspects of their life in terms of ability to work, quality of life issues. And I think many of our government programs that are targeting those programs targeting those populations can do a much better job kind of considering how those programs affect health and how they affect nutrition so that they can support those areas and result in better outcomes for families.
Thanks so much, Angela. Tariq?
Like everyone else, thanks, Jason, for having us here. Really excited to talk about impact of policy on the way businesses, individuals interact with the food system. It's a large part of the work I do every day. You asked a really big question, and I think every of my colleagues here have answered it very well. We could probably talk about it for hours. So I'll add on to thinking about kind of the milestone changes we've seen over time through referendums, executive orders, and the judiciary having a large impact on policy and kind of the operation implementation that we see within the food system space, right? So nutrition security, how local municipal governments do that work. And all these things are impacted by the controlling parties from the local to the national level. And recently we've seen kind of erosion of some of those individual protections and funding for individuals. And I'm concerned about how that looks in kind of the funding atmosphere we're in at the local level, what happens at the national level as we kind of increase our total national debt, and what those finances look like and how we continue to support individuals and businesses overall. So that's really what I'm looking to see and am concerned about.
Great. Really glad to have you to help bring that local perspective to this conversation as well, because it's not just the presidential election. It's obviously elections up and down the ballot. They're going to have an impact on these issues. Elaine, send it over to you. Last but definitely not least, go ahead and take it away. What's up top of mind for you?
Yeah, thanks so much for having me. Yeah, a +1 to all of the things that have already been raised. But I'll just mention that, we're just a couple of years out from a period where we had a really profound impact on food insecurity in a positive way. The lowest we had seen in recent decades. And I am worried that we're not learning the lessons of the pandemic. That we've walked back some of the things that had a profound impact, and that could be a further area of concern post-election. So I think the pandemic obviously was an incredibly disruptive experience, but it was also an opportunity to have a much more nuanced and robust conversation about what we mean when we mean food security and nutrition security. That we can't talk about these things as if they're just programmatic or specific conditions. Climate and agriculture and programs and health are all interconnected. And I think the other thing that we really need to wrestle with is why we have tolerated a significant level of food insecurity in this country through even the very best of economic times. We haven't been below 30 million people in this country. So when we talk about solutions, I think we need to remember that we still have so far to go. And so as we talk about what to do going forward, we need to know that we're actually making a dent in what is a long-term persistent problem. And that's a public health issue. We talk about it as if it's a social welfare issue. It's a public health issue. Food insecurity is associated with higher rates of diabetes, with hypertension, with cognitive development issues in teens. It's associated with depression, suicide, substance abuse disorder. We cannot untangle that. And some of the things that have improved food security are also impactful in reducing healthcare expenditures. So I just hope as we come out of this period where it becomes really difficult to have, sophisticated conversation, that we can get back to that more robust discussion about the things we're grappling with.
Thanks for that, Elaine. I think this is a start to that conversation. This is an opportunity to really weigh in and build some bridges here. I want to move Indy and talk a little bit about inflation, which has become a huge issue in this election cycle. It's impacted families, for the last several years, and the Democratic campaigns, Republican candidates alike are citing high grocery prices as a major concern. What's driving food prices, and what are some of the promising solutions that are out there on the horizon?
Yeah, thanks for the question, Jason. And I think just to start off, it's worth knowing the data here. And food inflation overall, but especially food inflation at home, has fallen quite substantially and is now comparable to pre-pandemic historic levels. So for perspective, food inflation at home, so this is as opposed to going out and eating, outside of the home, is around 1.3% year over year and has been around that level for essentially all of 2024. So it's definitely been tamed. And even though typical incomes are higher now, we may be struggling with a couple of years of high inflation from before that has sort of built up and built into prices, since inflation is all about the change in prices. So that increase and the sort of persistence of some of it stems from a complex interplay of different factors affecting the food supply chain. And it's challenging even for experts to exactly sort of weigh these various factors. But we certainly have some of that, the higher prices stemming from lingering supply chain and other pandemic-related effects. There were some increases related to geopolitical challenges, like the war in Ukraine. And there were higher energy prices for some time. And you can see how all of these overlap. Higher labor costs for some time. But there are even very quirky specific things like changes in pricing for fertilizers or transportation, even beyond higher energy prices. There's some evidence that there was some effect from some consolidation in aspects of the food supply chain system, and also climate change, I think, to some extent. As far as what we can do, we can, of course, invest in different food systems. These are choices we make collectively. We can support more sustainable practices in agriculture, diversify food production so you have more resilience and you can sort of mitigate against climate-related disruptions. You can certainly promote healthy competition, and there are specific things that one could do in the supply chain related to the infrastructure and even technology to even reduce food waste and improve the distribution networks. But I think we will need targeted assistance, such as food assistance that Elaine and others have mentioned, to help families, especially those with low and moderate incomes, but even sometimes higher incomes when they experience insecurity through a job loss or something like that, have access to nutritionally appropriate food. And I also think that in addition to the usual needs for continuing sort of research and innovation, we should have more cooperation internationally on some of these fronts. When you think about some of the issues that contributed to higher food prices, the U.S. was not unique in experiencing those, and in fact, in some ways, experienced them more moderately than some other wealthy countries.
Thanks, Cindy. Are there any other folks who want to weigh in on kind of inflation and how that has really impacted food prices and the global economy more broadly?
Well,
Stacey,
I'll just throw out
Okay.
there because I wrote a paper with Craig Gunderson about inflation, and well, actually, it was about the food insecurity increases in the last couple of years and what were the main drivers. And we did conclude that it was mostly inflation. And part of the reason we concluded that is because you see the increases in the food insecurity rate are disproportionately among relatively higher income households. So those households that are not actually even eligible for our safety net programs. And so I think it's just really important to call out the importance of inflation in terms of understanding food insecurity, and also then the need for policies that focus on taming inflation.
Absolutely. Thanks, Angela. And Angela, I'm just going to stick with you and ask you, what's at stake in the 2024 election when it comes to the federal safety net programs like SNAP, the child tax credit? These are issues that have come up consistently throughout the campaign from both sides. What stands to change for their beneficiaries under the different visions for the future?
Yeah, that's a great question. I mean, I will preface this by saying I'm a researcher by nature. I'm not a political scientist or a political analyst, but I think it's obvious to anybody, and I've been around long enough to know that elections have implications for how our policies are implemented, but just what those policies are. So I think in thinking about the upcoming election, there will be kind of large effects on safety net programs and how beneficiaries might experience those programs based on a few different factors, not only who wins, but kind of which party is in control at the different, if it's Congress or the White House. So I think there are large ways or big ways, and then there's small ways as well. So the big ways is really in my mind around legislation. So the Farm Bill, which oversees or administers reauthorized. It likely will happen in the next year, although we've seen over the past couple of years, we thought it would happen and it didn't. So, but I would expect probably in the next year. And so the Congress plays a huge role in that, obviously, and whoever is in the majority will be the one who is kind of leading that effort. And if we have split, if we have House and with the majority in one party and Senate in the other, that will create a completely different dynamic than if both are in the same party. And then a president has to sign any bill that comes out of Congress. And so that obviously has huge implications for not only the direction that the Farm Bill goes in and then ultimately SNAP, but also kind of the specific aspects to, changes that might be made. And then I'll just add to that kind of these small ways. I think much of that is related to who's in the White House because, well, as Stacy knows, who's in the White House appoints leaders within each agency. And those leaders do have a lot of, authority, a lot of ability to influence policy at that level in many ways that I think a lot of people don't realize or don't even see on their day-to-day basis, but they have a huge influence over the direction of some of these programs. And so I think, depending on who is in the White House, we'll see some of those implications as well.
Thanks, Angela. That's very helpful. Elaine, you had mentioned just a couple of minutes ago, a lot of lessons were learned from the pandemic in how to address a lot of challenges, and that a lot of that has kind of slid back. One of those big issues is the child tax credit. Do you want to share any of your thoughts on that and where it might go from here?
Yeah, the child tax credit, as we experienced it during the pandemic, was expanded in terms of its reach, its amount, and also for 6 months during 2021, it was actually paid on a monthly basis. It was an interesting natural experiment, and then we could observe what was happening with food hardship before, during, and after that. What we saw was that the child tax credit, along with the enhanced SNAP benefits, had a significant impact on food insecurity among households with children. That food insecurity rose almost immediately after the CTC reverted back to its original form. I think there is actually a lot of appetite among people of all different points of view for some type of CTC. I think it's continuing to percolate. It's hard to come to, agreement, and I think it's been stalled because, coming up to an election, there's just sort of a paralysis that sets in. But that was one of the powerful tools we observed, and something that we could turn to, I think, pretty easily going forward if we prioritize food insecurity as a meaningful public health issue.
Great, thanks, Elaine. Stacy, we've talked a lot today about food insecurity and how that's kind of health keeps coming up and the health impacts. It's something that you've long been talking about, the importance of integrating nutrition into healthcare and focusing not only on food security, but on nutrition security. What's the current situation and what shifts might we see in the months and years ahead?
Yeah, thanks for that. So when I was at USDA, the secretary really did and continues to want to advance the critical issue of nutrition security. And he defined it for our work at USDA as consistent access to safe, affordable, healthy food to support optimal well-being, right? So the idea that what we eat is pretty critical to our overall health, which, Elaine and Angela and several of us have reflected on, and wanting to make that the standard for which we were seeking out, which I think we thought was beyond the concept of food security. And food security has a nutrition security component to it, but just I think in our public policy dialogue, we've thought about it more as sufficient calories versus sufficient quality. So, and that's why it was an important directive for all of us, and why we really emphasized making the fruit and vegetable expansion in the WIC program, or the updated guidelines to the meals that we serve in child nutrition, all of which are pretty typical updates that administrations need to do, but I think using those important changes to talk about, why what we eat is so important to health and the role that the federal programs can play. I think, though, what we're starting to see reflects the conversation we're having here, which is healthcare is starting to talk more and more about food and nutrition as a driver of healthcare for, the very obvious reasons, which it is in fact that there were just several congressional hearings that were held by the healthcare side of the House, committees that we don't normally see talking about food, did so because in talking about its relationship to health. The Biden administration allowed states to do demonstration pilots through the Medicaid program, which is a health insurance program for low and moderate income households, to try allowing insurers to get reimbursed for providing food interventions for households. Let's say an elderly person with hypertension, connecting them with food resources, not just clinical health resources. So I think we've got different really critical players talking about this unbelievably important connection between what we eat and our overall health. And that is clearly going to go in, I think, I hope, an important direction about how we think about government's role in supporting good food, right? But not just in this notion of maybe delivering medically tailored meals in a clinical setting, but going back to some of the more systems issues that others on this webinar have raised around what are we growing, what are we talking about in terms of diet and health, and how are we supporting it? And I think that's really positive and powerful. I just hope we keep the people that we're trying to serve centered in all of that, right? And because food is one of the most personal things that we do and the way it connects us. And I think we want to make sure it's not, while it has a clinical impact, that the food we eat and receive and the way we enjoy it doesn't have a clinical orientation.
Thanks for that, Stacy. Angela, given your research and your thinking in this subject, is there anything you'd add to what Stacy shared there on the impacts of food security and health?
Yeah, definitely. And I think Stacy's really hit on kind of a key topic. And in my view, we're kind of at a crossroads when it comes to thinking about our food assistance programs. Because I think Elaine made this point earlier, like our safety net programs have done a pretty good job addressing food insecurity, especially if you look at very low food insecurity, which is kind of more of a proxy for hunger. So are people, having to constrain their purchases of foods due to resources? That's actually very low, fortunately. I think it's less than 1% of children are kind of defined as having very low food insecurity. And so that's great. But where our safety net programs have done less well is this kind of broader issue that Stacy touched on in terms of nutrition security. Like, what are people eating, the quality of food they're eating. And some of the research that I've done over the past year or so, we've looked in particular at SNAP recipients and looked at their health outcomes. And needless to say, they're not great. And I don't want to imply that SNAP causes bad nutrition outcomes. It's more, that people, some of these health issues put them in a position to need SNAP. So it's not, that causal relationship is not completely clear. But there's some very concerning health trends among our SNAP population, especially among those who are slightly older. Like, we looked at age profiles in the group of adults receiving SNAP who are age 50 to 64. Obesity rates were 40 to 50% higher than other age profiles and higher than low income non-SNAP participants. 60% had ever been diagnosed with a diet-related disease, again, much higher than the general population, even controlling for income, but are not SNAP recipients. And then we also looked at mental health outcomes, and those were equally concerning. So this is not just a physical health issue, it's also a mental health issue. And so I think that we really need to start thinking about our safety net programs, especially food assistance, not just around food insecurity and reducing hunger, but also how it affects health and how, are these programs effective in terms of improving health?
Yeah, and if I can just jump in on that, Jason, Angela's raising, I think that these are the right questions because we've got millions of households who are struggling economically, struggling in poor health. But I'm not sure, I think what we need to do is be thinking about, there's a huge systems dynamic that's driving these outcomes. It's where folks live, it's access to, again, safe, affordable food through a high service grocery store, for example. It's economic well-being, it's housing, it's safety. So to me, there is a reasonable question about, are the programs sufficiently resourced and designed to drive and support better health? But it's also, we see back to what Elaine said, there's so many other things and interventions that drive basic well-being health that we've got to also step out of our silos and think more systemically.
Yeah, and if I could just add to that, the truth of the matter is that this country as a whole doesn't eat well, doesn't eat the way we should. The obesity epidemic is not restricted to low-income people. Neither is the diabetes struggles that we're having. And, I think we're about to have a reckoning with the way we rely on ultra-processed food. There's a lot of concerning research that is starting to come out about the health implications of that. We have to remember, and I put this image in my mind, that when people walk into a grocery store, they're getting cues from their environment about what to buy. And a teenager that we interviewed several years ago said, when I walk in and I see a $4 box of strawberries, and this was a few years ago, so it's not $4 anymore, but a $4 box of strawberries, and I see an equivalent price on a 10-pack of ramen, you already told me what you want me to buy. And I thought that was like incredibly insightful, for a teenager. But that's really where we are, because food insecurity in this country looks a lot like compensatory behaviors because we go for the cheap, calorie-dense foods. And then we all sort of have developed a taste for those. So I think we cannot separate these conversations from that larger scenario and what we subsidize as a country in terms of the foods that we prioritize, because it does not match up with the foods that we tell.
Yeah, and I'd like to add on to that from like the local perspective. And I know we're talking a lot, but there's also, a systems level approach that we want to take here, right? It's not just, and to use my public health background, right? Food specific outcomes, but food sensitive outcomes we have to address as well. So sensitive meaning ancillary systems like transportation, childcare, high paying, high quality jobs that offer a living wage. So there's all these different components to that we can address that will help solve for some of these problems. And that's what we try and do in DC specifically, but also I think at the local municipal levels where our focuses really are on those residents and businesses to support them. And we're looking at attraction retention strategies for grocery stores, for small format corner stores, medium-sized stores. I know Stacy is well aware of the Healthy Corners program we have here in DC that's operated through DC Central Kitchen and gets support from our Department of Public Health, or DC Health, sorry, Department of Health. And we do a number of those add-on programs through local funds, through USDA federal funding, through philanthropic dollars as well, that really reinforces those outcomes we want to see. And so we're working on those locally, and more support at the federal level would be amazing to have.
That's actually a perfect segue to our next question. So I appreciate that. While the national elections are certainly going to have a huge impact on the daily lives of kids and families across the country, we all know that the work at the local and municipal level is going to continue, regardless of the outcomes. How are local governments thinking about food system resilience in the face of so many different scenarios and policy changes that could happen? What work is going to change? What work's going to continue? What do you hope to see?
I mean, short answer, nothing really changes and everything keeps going, right? That's how we have to operate. I think good at, like any good business, you operate on going concern. We're going to keep going forever and ever as long as we have, as long as we can. Longer answer, it's really hard. I think we've seen since the pandemic a huge influx in investments from philanthropy, through public-private partnerships, through federal levels, not only from the USDA but from FEMA, which was an interesting place to look for finding dollars to do studies on food system resiliency. From USDA, we've seen investments in, here come a lot of acronyms, so I'm sorry, LFPA, RFSI, the RFBC, so a bunch of infrastructure and producer supports, which are really focused on supporting kind of the upstream business to business infrastructure that we need to create that resiliency and redundancy in the market. And also creating opportunities and pathways for producers and food businesses to expand their market share and really create that support along those food supply chains, which is so critical for that regional and local economy to thrive and grow, to reduce, again, that reliance on the national and global food supply, right? So shortening those food miles and bringing those supply nodes closer to the demand nodes, which is really critical. And we're doing that through kind of human-centered design and equity-centered approach. So finding so in the district specifically, we utilize funding from FEMA to do an assessment of the food and water supply chain in the National Capital Region, which allowed us to map the entire food and water supply chain, not just for DC, but for Maryland and Virginia, the Northern Virginia area as well. And what we found from that, when we overlaid SNAP data from where recipients are purchasing before, during, and after disasters, we can track how those individuals who are most vulnerable move through the system and move through the region geographically, so that we can then tailor our recovery efforts into those areas where we know the support is needed most first, for restoring power, restoring water. We can look at grocery stores that serve those areas and focus on restoring power there first, because we know that's a critical need in that component. So as we look at that resiliency through emergency management, climate change, we're trying to take these innovative approaches to keep that equity centered, to keep equity centered in our processes. And of course, I think everyone's touched on this, particularly Elaine talking about the benefit of the child tax credit. I think the pandemic EBT work we've done, universal school meals, effectively, which we had for much of 2020, 2021, and 2022, partially in 2023, and we saw a huge reduction in food insecurity across the board. So we're looking at different ways to fund those programs. We have a Give, Snap, or Raise program in DC we funded partially through 2024 to support an additional bump. I believe Seattle also has a great program there that's supporting individuals who are in that income gap. There's that threshold that Angela talked about between the 200% of the federal poverty line and above, where you're still not making enough money but don't qualify for federal benefit program. So there's all these great innovations happening and funding for local dollars, and we have to be very judicious, I think, on how we spend as good fiduciaries of tax dollars, creative with how we approach our programs, and looking at those private and public partnerships that really can create 10x benefits on the public dollars we have as seed funding to draw in other programs that support businesses and residents across the board. So it's an all hands on deck approach. We look across our agencies to work together, and we work with experts across the space in addressing affordable housing, transportation access, childcare access, and creating innovations across the board.
Thank you for that. I want to kind of build off of your mention of FEMA there, and I'm going to send this question over to Elaine, but climate has come up in so many of the answers throughout this discussion. So I encourage the other panelists to jump in here as well. But we know that millions of people are still reeling from the tragic hurricanes that swept across Florida and much of the Southeast earlier this month. It seems impossible to have a conversation about our food systems without considering climate change, as we've seen today. What's on the horizon when it comes to food security, disaster response, and climate resilience? Elaine, I'll start with you, but others jump in.
Yeah, that's a great question. And it's obviously a very poignant time to be reflecting on that, given the experiences of the last several weeks. Regrettably, I think we have already entered and are becoming more aware of a phase of what we might refer to as compounding disasters, right? So we used to think about a disaster response and planning as event-based, right? These came periodically. We had plans for how to gear up. There was some period of recovery, but we moved on. And I think the intensity and the pace of disasters is such that areas will barely be recovering when something else may be coming. And then those areas that have experienced disasters will be weakened for some years to come. Just there's no way to have that level of disruption. So there's a really interesting recent report from the National Academy of Sciences on compounding disasters that I think would be interesting for people to take a look at if they want to think more about that. What that means is, a completely different approach to how we think about food system resilience, right? Because supply chain disruptions, as we learned during the pandemic, is a very profound issue, and that will be related to climate as well as other things like avian bird flu, other things like disruptions internationally has already been mentioned, things that we don't necessarily think about when we think about disaster. The other thing is that we don't have a response system that is fully adequate to dealing with compounding disasters as well as low-level disasters. For example, I live in Chicago. There was local flooding about a year ago on the west side of the city, which is a very under-resourced area. People are still struggling to recover from that and to get even basic assistance. That's not anything that made the national news, but there are lots and lots of areas that are beginning to experience these sort of low-level disasters that can take out your grocery store for some period of time, disrupt employment, disrupt transportation. And then the last thing I want to say that I think we don't understand enough about is there's some evidence emerging that climate will actually shift the nutritional quality of some of the things that we've been relying on, both in the US but internationally. And we can't separate our destinies, right, from the rest of the world. And so things like rice, that is some concerning evidence that there will be less nutritional value for the same amount of foodstuffs. So that will also require rethinking the importance of tackling climate change, but also the implications for what we need to do.
Great, thanks, Elaine. Does anyone else have anything to add? That was a great summary. Is there anyone who has any specific things they want to add to Elaine's comments on climate?
Well, I'll just add, I'll throw in one thing. I think that we were talking a little bit about the US, but climate is, of course, it impacts more small shareholder farmers around the world. And those are some of the folks where there is a weather disaster or even a natural disaster, or even a political military, in terms of its disastrous implications for the region. They have the hardest trouble coming back because, of course, they have the fewest resources and assets to do so. And at the same time, we're asking everyone to climate adapt, right? Change the crops that you're growing, change the means by which you are planting and harvesting food, storing, and then processing and distributing. And so I think we just got to keep building in this idea that that kind of adaptation requires resources, it requires support, and then building that on, coming back from that on top of a disaster can be really tough. And I think we're asking our foods, particularly the producers in our food system, to make a lot of change without necessarily providing the necessary supports to do it. So that really needs to be a priority.
Yeah, and I'll add on to that, right? I think zooming at the global perspective, right? The burden of climate change and the impacts that it has on the world is borne heavily by the global South. And climate finance is, a field that's relatively new and incoming. And we need to be more, and I'll speak as a citizen of the US, I think we need to be a bigger player in that space and financing what will be the largest producers in the world, larger in the global South, of food in the future. And that is going to be a critical lifeline for how our current society operates and how we think about our relationship with food longer term. And there are, security concerns attached to that. I think food is a national and global security concern, and it's emerging, and that's largely tied to the economics of who's financing countries across the world, and where those dollars are coming from, and what their interest is, and how they're utilizing that space. And so climate finance and the economics of how we finance food systems globally is largely becoming, I think, this is a very probably polarizing term, but I think colonialism in a way. And we have to be really aware of who's investing, how they're investing, and what their end game is.
Thank you. I think that goes to kind of the next topic that I wanted to move on to. So thank you. This is I'm going to send this out to everyone. Elaine, maybe we can start with you again on this question. We all know the impacts of changes to our food systems, whether they're caused by new or shifting policies, political polarization, economic swings, conflicts abroad or at home. They're not born equally. Which populations are most at risk right now? Who stands to win? Who stands to lose? How's that balancing act happening?
Yeah, that's a big question. I think, it is very helpful to center, whenever we're talking about choices in front of us, the fact that there are groups that are disproportionately affected both by diet-related diseases, as Angela was mentioning, food insecurity, and they are often people of color. The food insecurity rates for people who are Black or Latinx tend to be double of what they are for white households. We have less good data on Native American households, but smaller studies tell us that it is a very significant issue there. And that's on top of having disrupted the food systems that those tribal nations had, long before. And so certainly people of color, but households with children in general, food insecurity rates are always higher among households with children. And that ultimately affects all of us because, that is literally the next generation. I think something that doesn't get talked about enough are people with disabilities. And it's not just an individual who has a disability, but if there's a disability in your household, that whole household can be affected, and that's a higher risk of food insecurity. So by the time you add up all the people that I just talked about, that's a majority of the communities that we live in.
Well, Elaine, thank you. Going back to kind of our list, we'll go backwards here. Tarek, I'll go to you to share your thoughts on this question.
Yeah, I think Elaine touched on a lot of those key points, and overall it's difficult, right? There's the challenges we face with shifting policies, with polarization, with the economic swings, everything that's going on. Obviously, nothing is born equally, and we see it in microcosms as well across the U.S. Right? Those with I think the local space, we see the NIMBY movement, right? Not in my backyard, which comes up when you talk about processing plants and how we locate grocery stores. And we see it in, where does this highway cut through, and to divide communities apart. And so those with more means and with more access to the political sphere and education and knowledge of how to interact in those spaces usually win out. So there's a component there as well. And so it's really important, the way we look at our work at the local municipal level, to make sure we're not building a system for people, but individuals are building the system, and we're bringing others into that conversation and iterating on that to ensure that the process works for, well, I want to say everyone, but let's be honest, the majority of people, because we can't make everyone happy. And so that's really critical in how we approach our work, and stakeholder engagement comes first. And lots and lots of conversation in communities with people, and coalition building and making individual relationships to learn how we can support everyone, or as many people as possible. And so that's really critical. So like Elaine said, it's not equally born, and she hit the nail on the head for all those individuals. And so we focus our efforts to be a part of that group that creates the change.
Thank you. Angela, do you have additional thoughts here from your work and your research?
Sure. I mean, I guess to the question of kind of which populations are most effective or most affected, you know, I mean, Elaine's exactly right. It's the populations that are most at risk for poverty. And, you know, in my work, I really study the relationship between safety net programs and employment. So in my mind, most things come down to employment. And I think if you think of it through that lens, you know, this issue of, you know, why are the disabled population, why are they going to be disproportionately affected? It's because, you know, limited employment that is created by disability puts them in a position that they're more likely to be in poverty and then need these programs. And so if we think of it that way, that, you know, what populations have barriers to employment that then creates the situation where they're going to need these programs, we have to then address, well, what are the underlying causes of that lack of employment? And when it comes to issues like disability, you know, I think some people might be surprised to learn that many of the disabilities people identify are actually nutrition related. And so, you know, many disabilities are mobility related, for example, that stem from diabetes or stem from obesity. And so to me, we have to look at it more holistically, that it's, you know, we can't just design programs to help people with a disability. We have to think about what are the underlying causes. Are there other parts of the system that we can address that then maybe treats that condition or makes accommodations for certain disabilities so that they can work and then they can try to get themselves in a better economic position. So I guess I'm trying to say it's, you know, the populations that are most affected are the ones that are the most vulnerable to a variety of issues. Employment's one of them, you know, lack of educational opportunities is others. There's many of them. So we have to think holistically about food security and food systems within that broader ecosystem of our safety net programs and the reasons people find themselves with limited income.
Thanks, Angela. I'll pitch the same question over to you, Indy, to share just, you know, which populations are most at risk right now. I think we've covered that one, but who stands to win, who stands to lose? Like, what do you see on the horizon here?
Well, I would add, we're talking about folks ultimately who face impossible choices in the face of changes in food systems. So that can include some other sort of populations that overlap with the populations that we've already discussed. So, for example, there's a lot of folks who have a significant needs for caregiving, overlaps again, sometimes people with disabilities, but sometimes not. And they could face very tough choices with their budgets if, in particular, becomes tougher to afford food. But it's also about time too. So there's a time budget, right? You have only so much time in a day, and you know we're not all flash. So we have to find ways to manage our time. So shifting sometimes away from food outside the home to food at home can add time. And there's other such choices that people could face. So, you know, I think a lot about people who are enrolled in higher education too, sometimes with limited resources, and they have both the time and resource constraints. But I don't know that we've mentioned small scale farmers, because I do think that they can struggle a lot to sort of manage through some of this uncertainty. And you know, Stacey talked about producers more generally, especially in other countries, but even in the U.S. insofar as there are still some small scale producers, there's every reason to think that enough volatility will sort of put them out of business. And that can be challenging for lots of reasons, including what Tariq was talking about bringing the nodes of supply and demand sort of closer together. So I think, this is a genuine situation where I would argue even if, say, large corporations sort of somehow benefit from the uncertainty, it's a lose-lose situation, in my view. And I do think there are some lose-lose situations, failing to address climate change would be one of them. But I think this is one. And then we haven't talked as much about the elderly, but one thing we know about nutrition programs, including SNAP, is they do seem to help with people's budgets. And that means that they don't forego needed medication and other care in the health side as much. So I would just note that, yes, we need to look holistically, and SNAP has these effects, or WIC has these effects, or the school meal program Sharik mentioned has these effects on other things too we care about, like educational outcome and achievement, and certainly healthcare. But we could sort of keep going. So we need to look holistically to address our needs in pursuing food justice, and appreciate that the food focused programs have lots of collateral effects.
Thanks, Indy. And Stacy, it wasn't intentional to have you come last on this one, but I think that, and not to put words in your mouth, but I know that in your past experience, you spent a lot of time thinking about this. So would love any additional thoughts or echoing things you might have for the thoughts of the others.
Well, I think everybody has captured it, and I was going to mention small independent new farmers, and Indy got them. So I think, really what we're saying is we have a food system that isn't really the food system we want, or it's not resulting in the outcomes that we want, and it's not serving everyone that we believe it needs to. And I think the answers here just underscored all of that, that if we center ourselves in creating a vibrant food system where safe, healthy, affordable food is there for everyone, that small and beginning farmers can thrive. Of course, we want that. We need more producers in the system, not fewer. And that all of those who are working so hard at every point in the value chain are rewarded for that work. I think that's really what, and of course, and that the planet is better off as a result of the food we're producing, not worse off. And that our health thrives. So that's really, I think that's the mission statement, and working to get from here to there is the work.
Absolutely. I want to make sure we leave some time for Q&A. So if you have questions, make sure you use the Q&A function, and we'll get to those in just a second. But before that, before we move on to those audience Q&As, I want to give each of you an opportunity to share what makes you hopeful. What are the bright spots out there for you, and things that you're thinking about? So I want to go to and start this a little differently. Indy, can I start with you on this one, and then we'll just bounce around to the other panelists as well.
Sure, Jason. So there are, I think, things that give me some hope. We are taking steps that I certainly wish we had taken years ago to start addressing the climate crisis, and it relates, as we've all described, to food security and nutrition security. I think there's more of an understanding of these issues as relate to our national security, which can give some sense of urgency. It can certainly affect things like migration, but also how we as a nation are resilient in the face of some of the challenges we've discussed, whether it's extreme weather or pandemics, or even potentially war and military conflict. In some instances, we've seen some bipartisan agreement, sometimes to not at least make some things worse, but we have seen some bipartisan agreement. I think we've seen a lot of local grassroots movements that maybe showing the way forward on some of the issues, whether it's sort of more local agriculture, mutual aid, or other such organizing, some of which just came about during the pandemic out of a sense of necessity, I think. We've seen some progress as well on equity, and showing at least how we could achieve equity in the pandemic, as Elaine described, whether we learned from them and those instances and those examples and decided to sustain them or not. And unfortunately, in many cases, we didn't. But that doesn't mean that conversation is over. Those are just some of the things I think from my perspective that give me some sense of hope. I haven't told you if that hope balances out my lack of hope, but those are the hopeful bits.
I think that could be a much longer conversation. Angela, I'll pitch it over to you. What makes you hopeful?
So I would say I am hopeful, and part of the reason is because I have noticed a shift in kind of how we talk about the issue of food security. And, I'm curious kind of if Elaine and Stacy might agree with me on this, but I kind of started in this space in the early 2000s, working in New York City, working, in SNAP. And I've noticed a shift over the past 20 years, just in this focus, to use Stacy's words, on, quality of calories, not just quantity of calories, meaning a shift from just, needing to address hunger in our communities to needing to address nutrition and health in our communities. And I've especially noticed that shift maybe politically within the last decade or so. And so part of me that makes me hopeful that movement is possible. But then I also, on the other hand, think that's been 20 years and there hasn't been any sort of like major legislative changes, or there hasn't been any real improvement in outcomes. So maybe less hopeful that it might take even another 20 years to see some actual change. But I think things are moving in the right direction, and maybe we just need kind of one event that kind of pushes us over that kind of line that really does make this a systemic issue, looking across the system, and how do we really address these concerns around our food system and what people eat.
Great, thanks, Angela. Stacy, I'll send it over to you.
Well, thanks for that. Well, I will say quickly, just working on a college campus now, the energy and the awareness of the issues of the youth, the students that I am now surrounded by, is quite inspiring, right? They see that these are issues that need to be tackled, and they're leaning in, both with wanting to equip themselves with the knowledge and information to do it, but also I think asking those of us who help build or accept the system that they're inheriting to fix it. So that, I think, is quite, just on a personal level, energizing. I think on a professional level, I could give you a bunch of examples of amazing things happening at the community level, just in my hometown of DC, that are quite inspiring. But I think sort of more broadly is that we're centering the equity conversation in how we diagnose the problem, talk about how we got here, and really set the bar for where we want to go. That just wasn't happening early in my career at all. And it has been such a important through line and shift, so that we can actually talk about who is experiencing food insecurity at much higher levels, but why, right? What are all the structures and drivers that got us there? And so we're, it is just more of it's a more honest conversation, and it's more oriented that the systems that need to change to make things better. So that maybe makes it a little bleaker as we tackle the problem, but I actually think it's much more hopeful because it's just more honest, analytically, and with respect to where we need to go.
Great answer. Thank you, Stacy. Elaine, I'll pitch it over to you. What makes you hopeful?
Sure. I do think there are a number of bright spots. I think summer EBT was a huge win. We have known forever that food insecurity in the summertime was a really significant issue, and we finally did something about it. There are things that it could be improved about the program, not the least of which is not every state took it up, but I think that's a great one. I think having learned a lot of lessons about the power of universal school meals, it's unfortunate that we didn't extend that lesson nationally, but a lot of states, including not just blue states, have picked up that mantle and understand that the whole school environment benefits, school food workforce benefits. There are lots of benefits when you do that sort of thing. So I think those are a couple of recent innovations. I do think we have lots of lessons from the pandemic that are right at our fingertips. We talked about CTC. You know, we learned that if you lean into SNAP, lo and behold, it does an even better job. So I think there's lots for us to draw from. I want to say something that probably seems a little odd, but I want to give a huge shout out to the people who work in our food system. It's not a bright spot in the way that we treat them, but it is absolutely the thing that kept us all going in 2020. I mean, they showed up for work. They have the least workforce protections, really, of many of our workers. They are often poorly paid. You know, Central Valley produces an enormous amount of our food. It also has some of the highest food insecurity rates. So, you know, we have both an amazing, resilient backbone of food chain workers that we should do better by. So I think we have to always have that assets and risks conversation together. Those are the things that are on my mind.
Thanks, Elaine. And last but not least, Eric, take it away.
Yeah, thanks. I think everyone really touched on all the major things. I will concur with Stacey. I think that the changes of culture over time, we've seen a shift from consumerism accumulation of things to more experiences and a desire to do good for others. And I've thought about this a lot, and I think it's more of a function of kind of the later stages of industrialization and having addressed more and more of our kind of collective basic needs. So, you know, Maslow's hierarchy and meeting those needs, and we can focus on other things that are more larger to community, which is really important. I'm really encouraged by the collaboration we're seeing, the breaking down of silos from across different disciplines and organizations, and taking that more, you know, systems level approach and, you know, collective solution driven. That's a lot of just consulting-y terms, I'm sorry. Kind of really focusing in on how we do good together, and, you know, again, that food specific and food sensitive outcomes that we're working on, and I think that's really great. And then I'll also echo, you know, Elaine's component as I say, a recovering chef. You know, working the food system, it's hard. The hours are tough. It's hard on your family. The pay isn't always great. The benefits aren't always there. It is challenging. And so the people that work in our food system are the backbone of, you know, the system we have. And without them, we would not be able to have conversations like this, because we'd be, you know, out homesteading, you know, growing our own food and specializing in doing that work. And so that work allows us to have conversations and have these bigger solutions that will hopefully push forward the global food system space. And I know we want to take some questions, so I'll leave it there.
Yeah, I appreciate that. And I'm going to take a point of personal privilege and give what I'm hopeful about. I'm hopeful that we're going to be able to continue to have these types of amazing conversations, you know, going forward. And I'm so thankful for all of you for joining us today. We got a couple questions from the audience here. And Stacey, I want to go back to something that I think that this one really applies to something that you said in your comment. You could talk about lots of things that are happening at the local level and that are really exciting to you. What are some of those innovative policies or community-based approaches that you think hold the most promise for creating sustainable change?
Oh, interesting. Okay, I'll give two examples. One, it comes from our great friends and partners at Feeding America, which is an organization of many of our food banks, food pantries, soup kitchens across the country. Amazing organization. They have really been, I think, coming out of the pandemic, doing an assessment of what worked and what didn't. It was an unbelievable moment for them, and they more than rose to the occasion. I'm sure many of us remember those long lines of folks in cars, miles long, to queuing up to receive food. But they also, they more than rose to the occasion, but they also saw that maybe their network wasn't able to reach all of the places or all of the communities that they would have wanted to. So they, for example, have this great effort going on to take a look at their work in rural areas, and in particular, are they serving Native communities particularly well? And if they're not, who is, right? So I think that self-reflection is really important. And then how do you lean in to resolve? So I give them tremendous credit for that. But an example of a great small program I saw this week in DC was Farm Fresh. It's a wonderful local urban ag nutrition education organization in DC. They stand up a number of farmers markets around the area. And then by working with local producers to sell in those markets, they also have arrangements to buy food from those producers for food prescription programs and food distribution programs that they run. So they're really working hard to support the local food system and agriculture and connecting that wonderful local delicious fresh produce with folks in need in the community. That takes a lot of work. But they are in it for the love of it, and they're because their value is about supporting producers as well as people in need. So that's just a wonderful bright spot locally.
Thanks, Stacey. Those are great answers. We have time for one more person to just add anything onto that, local programs that you think hold a lot of promise.
I guess obligatory will jump in. Stacey, one quick correction: Fresh Farm, not Farm Fresh. Farm Fresh is Rhode Island.
Sorry. Oh
Fresh...
my God.
No, it's okay. I know. I know that group well, and they would get
Thank
mad
you.
if I
I'm
didn't
sorry.
do it. No, all good. Hugo's great, and their organization is fantastic. I think one of the things that we have in DC, which is really innovative, is the Nourish DC Fund, which, full disclosure, I do manage that currently. That program. It's a public-private partnership with community development finance institution, Capital Impact Partners, who runs that, and a bunch of different organizations, including some nonprofits, some other funders, LEDC, Wake If, City First, Dreaming Out Loud, Eats Place. I'm forgetting a couple, but that's the idea of it. And that's a public-private partnership fund. We seeded that with, I believe, a total of just under $5 million, and they have had, I think we've had total of almost $20 million through philanthropy and public funding together, in financing, in grants, in technical assistance and programs. And it's across the food system to support food entrepreneurs, not just for businesses, but to right size and not just continue to grow, and free reign to do with those funds as needed for the business that's right. So we're really excited about that, and we'll continue to support and grow that organization and that fund.
Awesome. Thank you all so much for your time today. I want to hand it over to Corby to close this out. Thank you.
I'm Corby Comer, Executive Director of Food and Society at the Aspen Institute. So thrilled to do this great series with our fantastic partners at Share Our Strength, Chuck and Julie. Thank you to our fantastic moderator, Jason, and our great panelists. I've been getting so many emails about people who've been inspired by what they've heard today. And of course, those who weren't able to join us today will be able to hear on the recording, which we'll be sending out soon. We'll be posting it on our site, aspenfood.org, where just today at noon, we posted the new applications, call for applications for our Food Leaders Fellowship. Fantastic leaders, including Tarek Sharif just today. So we invite you to nominate and form the cadre of the future. They are all fantastic and exciting. Our next conversation on food justice will be in December on the topic of food justice and philanthropy. We'll definitely be sending out notices, and the recording will easily be available. So stay on our newsletter list for our next conversation on food justice. And what an inspiring joy to have everyone join us today. Thank you all for joining us.